One of the things to keep in mind is that public health, like health in general, is related to socioeconomic factors. And what I mean by that is there's like a behavioral science behind all of this. And the systems that we're talking about are very, very complex and they're very interrelated, and you sort of can't impact one without impacting the other. So keep in mind that we are talking about three sort of components, sort of the broad social influences that the society has on your health, and that can be the norms that are shaped by what is acceptable, what isn't acceptable, patterns of social control, who allows you to do what. Certainly not providing opportunities so you can engage in alternative behavior. So if there's no safe place for you to walk or no sidewalks, how can you walk to school? How could you safely walk to school if those things aren't there? And there are certain stresses related and behavioral issues that might come up because you're in a stressful situation that does have an impact on your health. So those are all kinds of very complex things to think about. There's also something called culture. Now, I know that's a very broad term and it's related to behavior, but it can be impacted in different ways depending on culture hits you different ways depending on if you are part of what's called the so-called dominant culture, if you're a male or female, or you define yourself as some other entity, person, thing in the world. Where you are depends on what your culture is and what you have choices within your culture to do, to be, to feel, to act. It is relevant because some cultures respond to certain symptoms some ways. Some places things are a disease or something horrible, and some places they're just the way people are. So one of the things that our culture has done is they have sort of what we call made certain things into medical issues or psychological issues that previously your relatives wouldn't have seen that same way, your older relatives. So for instance, ADHD, previously people didn't get diagnosed, they would just say that kid's really active, he'll grow, or he or she will grow out of it. So now we've talked about it, and also addiction. It used to be that that was sort of a moral failing in our culture, and now it is a medical, psychological illness that can be treated. So that's a huge change in how our culture sees things. And some cultures change relatively fast, such as ours, with new science and new ideas and expanding concepts, things change. Other cultures do not change as fast, and change in your culture can depend on where you are in that culture and what subculture you are within the culture. So it gets very complex just within culture. Make that point. Some of the ways that things like religion can affect, and that's part of one's culture, it can impact what you do. There are certain religions where you don't take blood transfusions, so that's one way. Another way is that you may have certain medical interventions that are acceptable to you based on your religion and not with other people based on their religion. So there are lots of factors within culture, but religion is a dominant one. And the reason I'm bringing these up is you have to sort of look at where that person is, because we are going to talk about things like global health, but you have to look at the culture of where the person is, not the culture that you're in. And that's the same thing we see, the culture for certain people in cities is not the same culture that it would be for people who are in rural areas. So you have to sort of keep in mind where the population is, not what your culture is, but what their culture is. And you have to be expansive and understanding of that, because it can constrain, but it can also have some interesting points where you can sort of intervene and do things differently that you couldn't do in other places. Another thing to think about is that there are what we call social determinants of health. And what those are conditions that people are born with, they grow up in, they live in, they work and play in, and their age. And all of that works as a system that puts in place certain illnesses that impact health and the quality of life. So that's when I talk about where you live determines how you get to be successful, how you don't get to be successful, how you live, how you die. That's sort of those social determinants of health that shouldn't be there but are there, and you have to take them into consideration. Some of the key determinants, I'm just going to go through them really fast, the book talks about them more, is sort of social status, social support or alienation, access to food, healthy food or not healthy food, access to safe housing. It used to be that lead poisoning didn't come through the water, it came through the house and the water. Education, do you have access to education that will prepare you? The more educated you are, the better you are to use any information, especially health information, to make better decisions. Where's your house located? So the environment it's located in. Is it located near, as we've seen in certain places on the west side, was it located near a coal burning plant so that you had huge amount of asthma within a certain population because of where their housing was located? So environment does matter. What kind of work you do? Is it physical labor? One of the things that we sort of seen when we're trying to parcel out the opioid epidemic and why it happened first in rural places with people with an education level of just high school or a little bit above that, was because a lot of those individuals engaged in physical labor, and a lot of times when you're engaged in physical labor and that's your work, you are going to have issues with pain. And if you have a hurt back or hurt arm and you go somewhere, and the first line of defense is, we'll give you Vicodin, which is an opioid, as opposed to, we'll give you Tylenol. Then if you have a propensity for addiction to that drug, which is very high, and that's the first thing you get because of a real cause of pain, then you're probably going to go down that sort of horrible place very quickly. If you don't do physical labor for your job, you're not going to get those injuries. You're not going to be having that interaction where you get the opioid to begin with. Again, it's very complex. When we talk about the opioid epidemic, which we're going to do a lot as examples, a lot of this socioeconomic status stuff really does play into how people are exposed to it, when they're exposed to it, what resources they have or don't have, whether they live or die. All of those kinds of things really, really, really do matter. Another thing is transportation. One of the things we know about transportation is we've seen study after study that sort of the reason some people have better outcomes when they get cancer isn't because they have a worse gene or a worse variant of cancer, or that it was determined later, discovered later, or that it was a higher level when it was discovered. It's whether or not they have access to public transport so they can go and get treatment. If there's not easy access to public transport, even if they sort of all start out at the same gate, then it means that some people are lagging behind, because if you're somewhere that you can't get to transportation, then you can't get to treatment, and if you can't get to treatment, then you're not going to be able to get well. So it could be a rural urban thing, but it also could be whether you have access to public transportation or not, right? In New York, Chicago versus somewhere like Los Angeles, we both of New York and Chicago have public transportation, not so much somewhere in Los Angeles. Could have worse outcomes for the same type of patient presenting with a disease that we're going to talk about later. Is not a communicable disease. It's a non-communicable disease, and it's sort of a disease of people who have access to treatment, and how do we get different outcomes. Okay, so again, that whole environment where things happen really does determine how you look at the problem or the issue. Other things contribute to their health disparities, and those can also lead to, and stress, that can also lead to behavioral issue disparities, and access to resources for that is very much based on where you live and who you are. We look at certain things when we're looking at disparities in non-communicable diseases. We look at heart disease and hypertension. Black men and women are more likely to die of heart disease and stroke. We don't know why. It could be access to resources. With strokes and heart disease, it could be because they don't have access to places where they check their blood pressure. A lot of really innovative public health interventions based on where people are and where they can get information if they don't trust doctors or there's not enough doctors has come out of that. I'll give you a hint. Barbershop, beauty shops really have done some amazing public health interventions that have nothing to do with people like us going in, or doctors, or people like us and doctors going in and doing interventions. But it's about that community, what will work in that community to reduce the risks that are happening, so that we have interventions, people get interventions in a timely fashion, and they get equivalent outcomes to someone who lives somewhere else who has access to lots of resources. There's disparities we talked about in things like air pollution. Yes, air pollution sort of impacts us all, but if you live near a coal burning plant, you're probably going to have more incidents of asthma that may end up in death or hospitalization. Motorcycle vehicle incidences and motor vehicle incidents, usually men, usually younger men. They're just twice as likely to have accidents and be in cars that are maybe older or unsafe. one of the things that we have to think about too is that there are some communicable diseases, not just non-communicable diseases. So for instance, we're talking about HIV/AIDS. If you get HIV/AIDS and you live in a city, you're probably going to get access to places that have the standard of care. You might have even not get it because you might be exposed to PrEP. If you're somewhere rural in the South where there's not enough doctors, the access to resources aren't there, people don't have access to, because the Affordable Care Act wasn't expanded there, they don't have access to Medicare, Medicaid to pay for this, then they are going to have different outcomes than someone who lives somewhere else. They're also not going to have the community support. They might have no way to get to the treatments, no way to get to the doctors who have the knowledge. So again, where you live determines a whole lot of stuff, but that means that where you live also has to determine the interventions that we as public health officials or public health people do. Also, people who come up with health policy have to keep in mind that a policy rollout is also determined by social determinants of health. So if we want to be successful and help the most people live to their fullest potential, then we have to make sure we keep all of this in mind when we are even defining a problem and talking about a problem and coming up with interventions.